The United States is experiencing a rapidly increasing frequency of drug shortages. In the past few weeks, there have been reported shortages of amoxicillin and Tamiflu in the midst of a surge in respiratory infections. Albuterol is used for young patients with asthma to alleviate breathing problems, and it's been in short supply for months. Health officials say drug shortages are caused by numerous factors, including difficulties in acquiring raw materials, manufacturing problems, and regulatory issues.
The founder and president of Healthy Tennessee and a Nashville-based trauma surgeon, Dr. Manny Sethi, is with us now. Dr. Sethi, welcome. Thanks for coming on. This is concerning, especially if you're in desperate need of these medications.
That's right. Well, good morning, and thanks for having me. You know, we've been seeing these national shortages for some time, and as you mentioned, it's getting worse. You know, amoxicillin, Tamiflu, albuterol. As we're seeing this kind of coming together of COVID, of RSV, of the flu, people are getting what we call super infections. So amoxicillin is important in kids and adults, and we're running out of it. Same with Tamiflu because of the flu season, and albuterol. And you know, this is something that we're facing more and more as supply chains are getting tighter across the world. Now, a lot of this stuff is made in China, you know, because of our raw ingredients, and the supply chains are based out of there. And this is something for our national security interests over time. We are really going to have to change to bring, you know, the production of a lot of these medications stateside.
You know, Doctor, health officials say, you know, this drug shortage is causing folks to turn to alternative sources of medical procedures and ways of getting their the drugs that they need. How much of a danger is this, folks turning to alternative therapies when they can't get the drugs they need?
Well, in some cases, it's, you know, we can do that. For example, with amoxicillin, there are other antibiotics, but amoxicillin is great because of its, you know, there are low numbers of side effects in kids, et cetera. So you can give other antibiotics, but then there are things like insulin, for example. You know, in the past, we've had shortages of insulin and a hard time getting that, and that's a real challenge. For example, in my world of trauma surgery, if you can believe this, we had a shortage of IV contrast, meaning, you know, when you're trying to find, you know, bad bleeding in the pelvis or the abdomen, you really need that. And we were limited in our supply. And so this is something that we really got to think about. And again, it's a national security threat. And we have to bring these production chains and supply chains, I think, over to America, which is something, this all started during COVID, during 2020. And I was very optimistic that we would change this, but we just haven't.
Yeah, manufacture these medications here, stateside. That way they're available to people who need them.
That's right.
Dr. Sethi, what would you recommend to folks who can't find these items right now? Should they try to call ahead, call around to different pharmacies?
Well, you know, unfortunately, yes, you have to be creative, you know, call different pharmacies around. You know, I have found that more local pharmacies will have better access in some cases than your CVS or Walgreens for whatever reason. But then just talk to your healthcare providers about different alternatives to antibiotics, for example, amoxicillin. Tamiflu, you know, that's a great drug. There's not many alternatives there. But I would just encourage people, talk to your healthcare providers. Don't just kind of do things willy-nilly, because, you know, there are side effects to every drug. And you should just be educated about whatever decisions you're making.
Yeah, keep an open line with the doctor you trust. Always some good advice there. Dr. Manny Sethi, thanks for joining us today. Appreciate it.
Thank you.